Today we will be discussing a biomarker that has been linked with an increased incidence of cancer in obese people. We will be reviewing the latest literature on this topic. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. Obesity is a risk for cancer, as many of you know. In fact, there is a very long list of cancers, and I'll cite some of them, linked to obesity. Breast cancer, especially in postmenopausal women, endometrial, colorectal, kidney, pancreatic, liver, ovarian, esophageal, gallbladder, upper stomach, thyroid, multiple myeloma, prostate cancer. Aggressive forms are more common in obese men. Cervical cancer, melanoma, higher risk in obese individuals is with melanoma, and the link is not always well understood. This list represents the major cancer where obesity has been shown to significantly increase the risk. Each cancer is influenced by mechanisms such as inflammation, hormone imbalance, insulin resistance, and metabolic dysfunction that are also associated with obesity. Today we will focus on inflammation as the mechanism of cancer in obesity, and the star of our discussion is interleukin 6 or IL-6. IL-6 is a protein that helps control inflammation and immune response in our body. Here's the best way to describe IL-6. Imagine this: you're in the middle of a high-stakes action movie. The hero seems to be helping the good guys, but then with a plot twist, the hero starts working for the villains. That's interleukin 6 in your body, a cytokine with split personality or a double agent. So let's look at IL-6, the hero. What does it do? So IL-6 is part of your immune system's first line of defense. When you get an infection, say a cut or a flu, IL-6 gets released into your bloodstream by immune cells and goes on a mission to save the day by several actions. First, it kicks the immune system into action by signaling your immune cells to fight off invaders like bacteria or viruses. It helps get inflammation going so your body could actually battle these infections. Two, it ramps up antibody production by helping produce antibodies that target these invaders, making it crucial in building this defense army. Three, it also participates in healing damaged tissue. After the infection is gone, it transitions into a healer by promoting tissue repair. It even helps control blood sugar and fights stress during illness. So in many ways, IL-6 is a superhero flying to save you from harm, so to speak. Well, now let's look at its dark, villainous side. So when there is too much IL-6 in your body, especially when it's not needed, it can wreak havoc. Imagine IL-6 running wild, throwing constant inflammation parties without an off switch. This happens in chronic diseases such as obesity, heart disease, and cancer, where inflammation never dies down, and that's when IL-6 starts causing trouble. First of all, too much IL-6 can trigger continuous chronic low-level inflammation, even if there is no infection. Over time, this damages healthy tissues. Also, it causes metabolic chaos. High IL-6 levels are associated with insulin resistance and, no surprise, type 2 diabetes. So now I'm getting to the point of today's discussion. IL-6 promotes cancer. It does that by encouraging cancer cells to multiply and helping them evade the immune system. It's like IL-6 becomes sort of a sneaky sidekick of cancer cells, helping them thrive. So what happens specifically in obesity? Fat cells become overactive. So fat cells, or called adipocytes, don't just store energy. They also produce and release hormones. One of them, the cytokines, actually being IL-6. In obesity, there is a lot more fatty tissue, and this extra fat produces more cytokines. In fact, 30% of the IL-6 in bloodstream can come from fat cells in obese individuals. So the more fat tissue you have, especially visceral fat around your organs, the more IL-6 gets pumped into your bloodstream. That fat is like a factory that essentially never shuts down. So now let's look at the latest research from Spain, and you'll see the reference. I will link it below in the description. So about 6,500 people, obese people, were monitored for 8.8, so almost 9 years on average. 40 0.5% of them were women, and the mean age was 60.9 years. None of these people had history of cancer. The common denominator was that they were obese, and also they were just diagnosed with type 2 diabetes as they were recruited in this study. Again, it has been shown that type 2 diabetes is associated with an increased risk for obesity-related cancers, and I'll list some of them specifically as they used in this study: breast, kidney, uterine, thyroid, ovarian, GI, as well as multiple myeloma. After about 9 years, 327 people developed cancer. The biomarker that showed correlation with this cancer was, you guessed it, IL-6, because people who developed obesity-related cancers had statistically higher levels of IL-6 compared to people who have not developed cancer. They summarized it by stating that increased IL-6 level were associated with higher risk for obesity-related cancers by 19%, and that obviously is statistically significant. So the question whether IL-6 could be used as a marker of cancer, specifically in obese people and people who have type 2 diabetes. Very interesting research. Thank you so much for watching. Until next time. If you enjoy topics on this channel, please check out my book, The Clear Skin Diet: Unlocking the Secret Link Between Food Sensitivities and Skin Health. It's now available on Amazon. The link is below. Thank you so much. Bye-bye.